This show is part of One Place, a daily network of focused briefings across the stories people follow most.
Welcome to our daily health and wellness roundup. We are diving into the latest medical research and policy shifts to keep you informed about the science affecting your everyday life and longevity.
Doctors emphasize movement and mental health for GLP-1 users.
Vivid dreams might actually lead to more restful sleep.
Cold weather causes 40,000 extra heart deaths annually.
FDA reviews safety of RSV shots for protecting infants.
California proposes a seal for non-ultra-processed food items.
The teen mental health gap grows in progressive nations.
Doctors question the accuracy of rapid home health kits.
Teens increasingly use telehealth for medication abortion access.
Nature connectedness boosts well-being in a global study.
Maternal COVID shots provide significant protection for newborns.
First, let's discuss GLP-1s. GLP-1 medications like Ozempic have revolutionized weight loss, but doctors are warning that the shot alone isn't a magic bullet. For patients like Jaylon Smart, who started the drug to manage severe ankle pain, the initial weight loss eventually plateaued. Experts emphasize that traditional pillars of health, like regular exercise and nutrient-dense food, remain essential. Without physical activity, patients might lose weight but fail to improve their underlying metabolic health. It is about building a sustainable lifestyle that supports the body long after the medication has done its initial work.
Mental health is another critical component that often gets overlooked during rapid physical transformation. Dr. Dafina Allen notes that many patients lose significant weight but still struggle with body image or deep-seated emotional issues related to food. Addressing the psychological side of weight loss is vital for long-term success. Whether it is through therapy or support groups, tending to the mind ensures that the physical changes lead to genuine happiness. As these drugs become more common, the medical community is shifting toward a more holistic approach that combines pharmacology with behavioral health.
Next up is sleep. We often think of a good night's rest as a period of total mental quiet, but new research suggests that vivid, immersive dreams might be the secret to feeling truly refreshed. A study from the IMT School for Advanced Studies, LUCA, found that people who experienced intense dreaming reported feeling like they had slept more deeply. This challenges the old idea that dreaming is just a sign of partial wakefulness. Instead, high brain activity during REM sleep seems to contribute to the subjective sense of restoration, suggesting that our nightly adventures are more than just entertainment for the mind.
The researchers analyzed nearly 200 overnight recordings, waking participants over 1,000 times to gather data on their dream experiences. They found a fascinating paradox. Even when the brain shows activity levels similar to being awake, the dreamer perceives the sleep as profound and high quality. This discovery could change how we treat sleep disorders and how we measure sleep depth beyond just looking at slow-wave brain patterns. It turns out that a busy, dreaming brain might be exactly what we need to wake up feeling energized and ready to face the day ahead.
Now to heart health. While we often hear about the dangers of heat waves, a massive new study reveals that cold weather is actually a much larger threat to heart health in the United States. Researchers found that cold snaps are linked to roughly 40,000 extra cardiovascular deaths every year. The study identified 74 degrees Fahrenheit as the ideal temperature for heart safety. As temperatures drop below this point, the risk of heart attacks, strokes, and coronary artery disease begins to climb significantly. This data covers 80% of the U.S. population over 20 years, highlighting a major public health challenge during winter.
The impact of cold on the heart is particularly concerning as the population ages and more people live with chronic illnesses. Lead author Dr. Pedro Salerno points out that while extreme heat also raises death rates, the burden from cold is substantially higher. This suggests that we need better strategies for protecting vulnerable populations during the winter months, such as ensuring adequate heating and providing public health warnings during cold fronts. Understanding this lopsided risk curve allows medical professionals to better prepare for seasonal surges in cardiac emergencies and helps individuals take necessary precautions when the mercury drops.
Moving to infant health, there is growing concern among pediatricians regarding the FDA's recent decision to review the safety of monoclonal antibody shots used to protect babies from RSV. These shots have been a major success, reducing hospitalizations by 80% for a virus that is the leading cause of infant medical stays. Experts like Dr. Yvonne Maldonado emphasize that these products underwent rigorous testing before approval. The sudden scrutiny, occurring amidst a broader political push to remake vaccine policy, has left many doctors worried that parents might become hesitant to use a tool that has already saved countless infants from ventilators.
RSV is highly contagious and can lead to chronic lung issues or asthma in young children, making these preventative shots vital. While the Trump administration has faced legal setbacks in its attempts to cut federally backed vaccines, the uncertainty surrounding the FDA's review continues to swirl. Infectious disease specialists argue that the science clearly supports the safety and efficacy of these antibodies. They fear that political interference could undermine public trust in essential pediatric care. For now, doctors are urging families to stick with the proven benefits of the RSV shots while the regulatory review process unfolds in Washington.
Next, California's food labels. California is considering a new bill that would create a voluntary seal of approval for foods that are not ultra-processed. Assemblyman Jesse Gabriel, who introduced the bill, argues that parents shouldn't need a chemistry degree to understand what they are feeding their children. The goal is to help consumers make healthier choices at the grocery store and encourage manufacturers to reformulate their products to avoid harmful additives. Ultra-processed foods, which are often high in salt, sugar, and fat, are linked to roughly 1,400 deaths a day in the U.S. due to chronic diseases like diabetes and obesity.
The proposed seal would use a specific definition of ultra-processed foods, focusing on those containing emulsifiers, preservatives, and high levels of non-nutritive sweeteners. Nutrition researchers believe this certification could make it much easier for school food services and everyday shoppers to identify truly healthy options. While the label would be voluntary, the hope is that it will function similarly to the USDA organic seal, eventually influencing national standards. By highlighting the third of packaged foods that meet these healthier criteria, California aims to lead the way in reducing the prevalence of diet-related illnesses across the entire country.
Now, teen mental health. A surprising new study has found that the mental health gap between adolescent boys and girls is actually widening most in countries with the highest levels of gender equality. While progressive societies aim to reduce discrimination, researchers suggest they may inadvertently create a dual burden for young women. Girls in these nations often feel intense pressure to excel academically and professionally, while still adhering to traditional expectations regarding their appearance and emotional labor. This combination of stressors has led to a significant rise in internalizing symptoms like sadness, nervousness, and sleep disruption among teenage girls in these regions.
The study, published in the Journal of Child Psychology and Psychiatry, analyzed data from a massive international survey. It highlights that adolescence is a critical window for brain development, and struggles during this time often persist into adulthood. The findings challenge the assumption that social progress alone will solve the mental health crisis. Instead, it seems that the specific cultural pressures of modern, equal societies require new approaches to support young women. Understanding these unique stressors is essential for educators and policymakers who are trying to reverse the declining well-being trends seen in teens across the globe.
Shifting to home testing. Rapid health kits for everything from vitamin D levels to menopause are becoming increasingly common on pharmacy shelves, but doctors are raising red flags about their accuracy. While these tests offer convenience and privacy, they are often far less reliable than professional laboratory work. Experts like Patty Shih warn that the high rate of false positives and negatives can lead to unnecessary anxiety or a false sense of security. For complex conditions like perimenopause, a single urine test is often insufficient to provide a clear diagnosis, as hormone levels can fluctuate wildly and require a more comprehensive medical evaluation.
There is also a concern that the wellness industry is over-commercializing self-testing, encouraging people to optimize themselves without proper medical guidance. While some tests, like those for pregnancy or COVID-19, are highly reliable, others can be like stabbing in the dark. Doctors emphasize that context and medical history are crucial for interpreting any health data. Without a professional to explain the results, consumers might end up pursuing unnecessary treatments or missing serious underlying issues. The advice from the medical community is clear. Use these kits sparingly and always follow up with a doctor for definitive testing.
Next, telehealth abortion access. New research published in JAMA Health Forum shows that teenagers and young adults are increasingly turning to telehealth services to obtain medication abortion pills. Since the overturning of Roe v. Wade, the number of abortions nationwide has actually increased, largely driven by the rise of online medical consultations. This trend is particularly significant for minors who often face daunting legal barriers like parental involvement laws and judicial bypass requirements. Telehealth provides a discreet and accessible option for those who may lack transportation or the financial means to travel to a clinic, especially in states with strict abortion bans.
The study found that young people aged 18 to 24 are ordering these medications at much higher rates than older adults. For teenagers under 18, the legal landscape is even more complex, with millions living in states where access is severely restricted. Telehealth services that operate across all 50 states have become a critical lifeline for this demographic. As the legal battles over reproductive rights continue, the data suggests that digital health platforms are fundamentally changing how young people navigate their healthcare options. This shift highlights the growing role of technology in bypassing traditional physical and legal barriers to care.
Now, nature and well-being. A global study involving 38,000 people has confirmed that a deep connection to nature is a universal driver of human well-being. Researchers found that this nature connectedness goes beyond just visiting a park. It is about feeling an emotional bond and a sense of oneness with the natural world. Across 75 diverse countries, including Brazil, Japan, and Nigeria, people who felt nature was part of their identity reported higher levels of life satisfaction, optimism, and resilience. This suggests that our relationship with the environment is a fundamental aspect of mental health that transcends cultural and economic boundaries.
The study is particularly notable because it moved beyond the typical focus on Western industrialized nations to include a truly international sample. Participants who practiced mindfulness and felt a strong bond with nature were better equipped to handle stress, a finding that was consistent even during the challenges of the pandemic. This research underscores the importance of preserving natural spaces not just for the sake of the planet, but for the psychological health of the global population. It turns out that seeing ourselves as part of the natural world is a powerful tool for fostering happiness and purpose.
Finally, pregnancy and COVID. A large-scale study of over 140,000 infants has confirmed that getting a COVID-19 vaccine during pregnancy provides vital protection for newborns. Since babies under 6 months cannot be vaccinated themselves, they rely on the antibodies passed down from their mothers. The research, published in the journal Pediatrics, shows that these infants have a significantly lower risk of hospitalization from COVID-19. This data reinforces the long-standing recommendations from the American College of Obstetricians and Gynecologists, providing peace of mind to expectant parents who want to give their children the best possible start in life.
Importantly, the study also debunked claims that maternal COVID vaccination increases the risk of other infections in children. Researchers found no evidence that the vaccine negatively impacts the infant's broader immune system. In fact, by preventing severe COVID infections, the vaccine may actually protect babies from the secondary complications that often follow viral illnesses. As medical organizations reaffirm their guidance, this study serves as a powerful reminder of the safety and efficacy of vaccination during pregnancy. It is a clear win for maternal and child health, backed by extensive data from thousands of real-world cases.
That is all for today's Health Roundup. Thank you for joining us for these essential updates. Be sure to follow the show for your next daily briefing on the stories that matter most.